Okay, hi everyone. So today I'm doing a mole removal and it's just a short live session, and we are thankful for the patient for having allowed us to shoot this live with you. So I've done already a few mole removals, and this is our CO2 laser machine, as you can see. So this machine we use for non-invasive laser hair removal, mole removal. And you can see if you come closer. See, these moles I've already removed. You can see all these moles have already been removed, and this one I'll be removing now. So you see, we can actually burn these off. So there are various ways by which we can treat a mole, and this is one of the ways. Of course, if it's a mole which looks a little serious, we don't recommend this method. And in those we recommend that we do proper biopsy of the mole and send it for histopathological analysis to see what is the nature of the mole. But these are all like the non-changing moles, and they are bothering her. So we've done mole removal here also with the same laser, and this is a big one that we'll remove. The flatter moles, actually what we do is we remove through Q-switched also, Q-switched and DAG laser. That takes a few sessions, although these ones, the elevated ones, we are able to remove through the CO2 laser. Can you make it ready? Yeah, okay. See, this is how we are able to do it. You're okay, comfortable? Okay. So for these two moles, we've for the others we've applied cream anesthesia for about an hour. And for the bigger ones like these two, we've also given her injectable local anesthetic. So you see, this can actually...
There is a question,
yeah.
Why you have been using a filter?
Oh, you don't want the filter? We can remove the filter, no problem. We'll change to a no filter, that's okay. But the point of this live is to show you the process, because we get a lot of questions about mole removals, and this is one of the methods. So once we are able to do a surgical mole removal, so we can, surgical mole removal also we can show. Although I don't like to go live with the surgical processes, they can look very scary on screen. But you see, and these moles, they are not only at the surface, they are slightly a little deeper. So we have to go a little deeper and burn them off. With laser, the only disadvantage is that these can come back, because in the surgical excision, we take it off from the deeper level. So there is really no chance of the mole coming back in those. But in the laser, because some rests of cells can remain there, and it's literally not possible to see microscopically what we've left behind. But yes, it gives a long-term control, and many of my patients have not they've seen good removal for a long time, 4-5 years follow-up also I have. The moles haven't come back. But we always tell the patients for the laser mole removal that, they might come back in a smaller way, or maybe after 2-3 years, the moles can come back. So, of course, this is non-invasive, non-surgical, no stitch, and all these, these will scab and fall off like the normal, like any small hurt you get or scabs that they form. These will fall off in 10-12 days time, and these will fill up nicely without leaving a noticeable scar. Scar will, if you look very closely, one little dot will be there, but that's not noticeable, and that is why many clinicians say that it does not scar. That's scientifically, I think it's wrong to say that there would be no scar. There is a scar, it is not noticeable. So we finished up with 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 moles we removed for her today. And so we'll clean it up, we'll apply ointment. There is a post-op care that has to be taken, because in Indian skin, hyperpigmentation is a real issue. And we can close that. Hyperpigmentation is a real issue, and that we need to take care of. We need to take care of it like any other scar. So of course there will be sunscreen, there will be healing creams and all this applied. So for 4 to 6 weeks generally we ask our patients to take care, and we think she'll heal really well. Thank you. Bye bye.